Don't forget to like the video and subscribe. Thank you, I appreciate you.
Hi friends, this is Dr. Pankaj Chaturvedi, your dermatologist from Midlinks Group of Clinics, New Delhi. And today I'll be talking about a very important topic, acne and its various complications. So first of all, this is a time of global crisis because of COVID-19. Everybody is locked down, and I hope each and everyone is safe in your family and is following the social distancing and taking all the precautions. So coming to this topic, because I picked this topic because when you open the switch on your TV, when you open your WhatsApp, everywhere you only see the COVID-19 and the coronavirus, and this is an attempt to just break this monotony and to teach you something about the skincare and to talk about certain things which you can do to prevent acne, and once the lockdown is over you can seek treatment if you have these kind of acne and acne-induced complications. So coming to acne. Acne is the most common skin disorder which is seen in 95% patients. So around us, around 95% people, they suffer from acne in their lifetime. Now, severity of the acne, it varies. There are people who have minor acne, there are people who have moderate acne, and there are people who have got very severe acne leading to serious complications. Now, why we have acne? What is the root cause? Well, the root cause of acne is little complex. The main pathology lies in our sebaceous glands, right? Sebaceous glands are the glands in the skin which secrete oil. So the first thing is hypersecretion of sebum. So your oil glands, they produce more oil than normal. Then what happens? Because of this excessive production of oil, these sebaceous glands, they get clogged or blocked, right? Sometimes you can see them in the form of comedones. Normally we call them blackheads, whiteheads. So these are nothing but the plugs in our oils which block the oil from coming out. When this blockage occurs, the oil gland swells up because the oil collects there. Then we have certain bacteria in the skin, and the most common one is called as Propionibacterium acnes. So this bacteria survives on oil. So whenever there is collection of oil, this bacteria will grow up, right? And because of this, we get infection, and that is called as acne, right? So root cause is excessive oil production and the blockage of your oil glands. Now, it's not that simple, right? So this is simplified version which I told you. There are various reasons. Like a lot of people ask, like, why I'm having such a severe acne on my face and my friend is having minor acne, just like blackhead and whitehead. So there are many factors which decide the oil secretion. There are many factors which decide how severe the acne will be. So there is a classification of acne. Acne, the minor acne, they are seen in the form of small, tiny nodules without any pus. We call them comedonal acne, right? In our day-to-day language, we call these acne as blackheads and whiteheads. Then there are acne vulgaris. Acne vulgaris are small yellowish acne. You just squeeze them and you see a bit of pus coming out. They normally settle in a day or two. So acne vulgaris. Vulgaris means the commonest variety. So most of the people in the teenage, they have acne vulgaris. Then there are severe acne like nodular acne, cystic acne, hormonal acne. We call them adult acne. So there are 13 varieties of acne. The commonest and the easiest one to treat is acne vulgaris. The mildest variety is comedonal acne, and the most severe acne are called as nodular acne. One variety, now there's a common misbelief that acne is a disease of teenage. It's partially correct. Acne is a disease of teenage, but there are varieties which also affect people who are 18 plus. In fact, there is one variety called as adult acne, which is typically seen in females who are 25 or approaching 25 or who are 25 plus. So there are different reasons for these kind of acne. I'll be covering these reasons in my discussion today. So uh, now the question comes: why we should treat acne? What is the need of treatment? As a common misbelief in our family, and our friends suggest that acne is a very common thing. You don't require a treatment. Everybody gets acne. So of course it's correct why people say everybody gets acne, because 95% people get acne. But why the treatment is important? Because if they are not treated on time, the consequences are very serious, right? People permanently get those small pits. The softness of the skin goes away. Skin becomes more porous. A lot of people come to us in my clinic with a complaint that, doctor, I have got a lot of open pores. So these are not open pores. These are the tiny scars caused by those comedonal acne, the tiny acne which you ignored in your teenage. Then nodular acne, or the painful acne, the big lesions, if they are not treated properly, if they are not treated on time, they lead to very severe scarring, the deep scars. The skin becomes very, very rough, and a lot of pits and big scars. The skin becomes little undulating. So acne should be treated because they have a potential of damaging your skin permanently. Now, when as we were discussing about the causes of acne. So common acne, as I told you, they're because of excessive secretion of oil. When we are in teenage, there are sudden hormonal changes, and because of that hormonal changes, skin becomes more oily. Now why? Because in the teenage, nature tries to make you more beautiful. Nature wants that your skin should have a bit of shine, bit of glow. And what is that? Oil, the layer of oil. So nature makes your skin more oily, and that oil is secreted by these sebaceous glands under the influence of the hormones, right? So hormones increase the oil secretion, but sometimes when the secretion becomes more than what we need, we get acne. Now, the severe variety, which is called as nodular acne. Nodular acne are the type of acne which are seen as big nodules in the skin. These are quite painful acne, and they do not settle in 1 or 2 days, right? So the first thing people notice that something is there in the skin. They can't see it, they just feel it. So a bit of pain is there. They can feel that some lump is there in my skin, beneath my skin, which is a little painful. After 2 or 3 days, they see a big pea-sized grain coming out, pea-sized nodule popping out, and that stays for a couple of weeks. So this is nodular variety. Now nodular variety is supposed to be the most severe variety of acne, which has to be treated, because if it's not treated, it gives you very bad kind of acne scarring. Another type of acne which we see in our common practice are adult acne. Now, adult acne by definition are acne which affect females who are 25 plus. Now these females, they often come to my clinic with a complaint, the doctor, as everybody says that this is a condition of teenage, but I'm 35 and I'm breaking out. Look at my jawline, look at my face, and why I'm getting these acne. I'm applying these over-the-counter creams, I'm using all the face wash and whatever creams are available in the market, but these acne are not settling down. The reason is these acne are deep-seated and they are caused by hormonal imbalance. So most of these females who develop adult acne, they have underlying hormonal issues. The most common one is called as polycystic ovarian disease, or PCOS. But at the same point of time, I get a lot of females who say, doctor, all the reports are normal. They come with the report and they say, doctor, look at my reports. Everything is normal. By blood tests are okay, my hormones are okay, but still I have these acne. So I'll tell you, there is one very important thing for you to understand, that not everybody has high level of hormones in the blood reports, right? 70% patients, they will show that hormonal disturbance is there, hormonal imbalance is there, but 30% of the patients, they have all the reports normal, because the root problem is not in the blood, the problem is in the sebaceous glands. Their oil glands are hypersensitive to the normal level of hormones, right? So normal report does not mean that there is no hormonal issue. Okay, so even in that case, they require specialized treatments in the form of hormonal pills, sometimes few other medications to correct their metabolism. So these are the types of acne which we see in our common practice. Now coming to the treatment part, how acne are treated. So there is no panacea for acne. There is no one treatment which you can say, okay, if you have acne, take this medicine or take this cream and your acne will be gone. The approach should be individualized. So it depends what kind of acne you are having. If you are having comedonal acne means the blackhead and whiteheads, then very simple measures like in the form of good face wash and good creams, they can also be very, very effective. So when somebody comes with comedonal acne, we normally give salicylic acid based face washes, we give benzoyl peroxide creams, we give antibiotic creams, and sometimes we tell the patients to scrub their face with a medicated scrub once or twice in a week. So this is what we do for comedonal acne, because the root cause is blocked oil glands, right? So if we do proper cleansing, if we take certain measures like if you're using makeup, don't sleep with the makeup on, remove your makeup properly, nicely with a makeup remover, cleanse twice in a day, don't use products, don't use cream based things, don't apply oils on the face. These days everybody's sitting on the Instagram and e-commerce websites, and they keep on searching for new things to apply on the face. And a lot many patients I see in my practice, because of these experiments which they keep on doing in your face, and they end up getting bad acne. So don't make your skin as a laboratory. It's not a lab. Don't experiment, right? So oils, greasy products, creams, they should not be used. Now coming to acne vulgaris, the common variety, the acne which are yellowish in nature, have a little bit of pus, and the commonest type of acne which we see in our day-to-day practice. So acne vulgaris, they require certain oral antibiotics, certain good face washes to dig your pores like salicylic acid, benzoyl peroxide. Then there are certain creams like retinol based creams, retinoic acid based creams, and topical antibiotics. So these creams and oral medications can be used to treat your acne vulgaris, right? But they should be only prescribed by a certified dermatologist, right? Don't experiment just going to a chemist shop and saying, okay, give me some antibiotics for my acne. Please don't do that, right? Because most of the medications, they have serious and potential side effects. So they should only be prescribed by a certified dermatologist, not by any general doctor, and not should be self-medicated. Then coming to the most serious variety, which is nodular acne. So nodular acne are not easy to treat. Why? Because they're deep-seated, they take time in responding, and they are the one which cause the maximum damage. For the nodular acne, the most common approach is a combination of antibiotics, certain topical creams, topical antibiotics, comedonal creams like benzoyl peroxide, retinoic acid, and sometimes isotretinoin, which is again a reserved drug, a drug which can only be prescribed by a dermatologist, not even by any other specialist from any other specialty, right? Why? Because this drug again has a potential side effect. So If you have these kind of acne, couple of things you can do at your home, like using a salicylic acid face wash. There's no problem. You can, and these are the face washes which are available over the counter. There's no harm because lockdown is there. Not everybody has access to a dermatologist these days. So you can use these face washes so that um, some kind of deep cleansing can be done. Pores can be declogged. Then um, as a moisturizer, you can use a water-based moisturizer, so that because as we discussed that these greasy creams and oil-based products, they clog your pores and they are comedogenic in nature. So if you will use a water-based moisturizer, if you use something which is very thin in consistency, your acne will not be exacerbated. And then you should consult a dermatologist so that you get a right prescription. Now, acne treatment has to be written after proper examination of the proper examination of your acne, what type of acne you're having. As we discussed, that has to be individualized. There's no one single treatment which can be given to everybody. So general measures can be taken at home by these tricks which I told you. But oral medications and isotretinoin, antibiotics, they should be prescribed by dermatologists only. So once the lockdown is over, visit a good dermatologist and get a proper prescription. Coming to the another type, which is adult acne. So as we discussed, these days I get a lot of females who often complain that they are 25 plus, they're in their 30s, they're in their 40s, and still they're breaking out. So these kind of acne are called as adult acne. Now adult acne typically are seen on the lower face, and they are mostly nodular in nature. They're not tiny acne. They're not one which will appear and after 2 days they will settle. They often stay for a week or so. Again, they have a potential of causing permanent damage. So for the treatment of adult acne, the first thing is a thorough hormonal evaluation should be done. Second, a proper history has to be taken. So your dermatologist will ask about your menstrual cycle. He will ask about how regular or how irregular it is. Then any kind of hormonal issues in the past, like a lot of people, they have a history of polycystic ovarian disease. A lot of people who have a history of fibroid. A lot of females, they have a history of ovarian cysts in the past. So this history has to be taken. And once everything is clubbed, we make a diagnosis of a particular hormonal issue. Also, adult acne are often associated with metabolic issues. So what is a metabolic issue? There is a syndrome called as metabolic syndrome. So we see a lot of patients who have who are overweight, and they also have lines on the neck and underarms, which is called as acanthosis nigricans. So in metabolic syndrome, there is a phenomena which we often see called as insulin resistance. So insulin resistance is also one of the very common reasons for adult acne. So insulin resistance has to be checked by certain investigations, and along with hormonal medications, we also give certain pills to correct the metabolism. This is how we treat adult acne. So hope everything is clear regarding the treatment part. Now there are certain do's and don'ts if you have acne. Of course, I know that as we discussed, this is a difficult time. It's a global crisis, and it's not easy to see a dermatologist these days. So if you're breaking out, you can take simple measures to at least avoid getting new lesions. So one, proper cleansing of your skin. So cleanse your skin twice a day. So very important, because the root causes clogged pores. So the more you cleanse, better the skin will be. Second, do not over cleanse. So as I said, cleansing is important, but should not make you cleanse your face every 2 hours too early, because if you over cleanse your skin, you'll make your skin dry, and dryness further aggravates the colonization of these glands by the bacteria. So cleansing. Then use a good moisturizer. A water-based moisturizer is important, not oil-based, not a cream-based moisturizer. Then makeup. So, of course, these days people are not using makeup because we have to stay indoors. But still, a lot of people are using makeup these days just to feel about it. And a lot of people have a hobby of using makeup at their home as well. So, if you are using makeup, try not to um, sleep while wearing the makeup. Always remove the makeup before you go to bed. Reason being, if pores will be clogged, your skin will get many comedonal acne next day. So this is also very important. If you have active lesions, do not try to pop them. Now, a lot of people, a lot of patients come to me. They say, "No, I love to pop my acne. It gives me pleasure when I'm just popping them out, and somehow I feel that my acne will be cured." If you pop your acne, you will get bad scars. Why? Because when you're squeezing acne, sometimes the infection, rather than coming out, the pus goes inside. So you end up seeding the infection even at the deeper layer. So we do not recommend squeezing your acne. So don't do that. If you have blackheads and whiteheads, you can take steam, and once they become soft, you can take a comedone extractor and you can get them extracted. But do not try this with with the acne vulgaris and nodular acne, because these acne have a potential of seeding the infection. Also, if you squeeze your acne because of nails, because of the trauma, you might develop dark spots. And these dark spots, if developed, may take a couple of months to go, and sometimes it may stay permanently. So these are the precautions. I usually do not support any kind of do-it-yourself or DIY because I've seen a lot of complications. There's a trend these days. A lot of people, they go to the kitchen, they take turmeric and they take lemon and they mix everything and they apply on the face. It doesn't work, and it has the potential of giving you complications. So do not do that. Simple face wash, a good moisturizer, good scrub, they're sufficient in the time of lockdown. You can use a good toner as well. Now I'll be talking about certain therapies for acne. So I talked about medical treatment. Now I'll be talking about therapies. So not everybody responds to medical treatment, right? So a lot of patients who have severe acne or acne which are leading scars and spots, they take a lot of time in responding to these medical treatments. Then what we should do? So now we have many acne specific therapies in our clinics, and these therapies, they expedite the response. Like certain chemical peels are there. So salicylic peels, azelaic acid peels are there. Then there are combination peels. Then there are carbon peels which are done by laser. So these are the treatments which can be done for acne, and we can actually achieve good results in a shorter period. So of course, it's a combined approach. Medical treatment and these therapies, they work synergistically, and they make your skin acne free in a very, very short period, and they reduce the complications. Now when we treat acne, the timing is very important, right? So a lot of patients, they come to me and they say, "Doctor, just write medicines and just write creams. I think I'll be okay." Of course, they'll be okay. But sometimes when I realize that the acne person is having, they're serious in nature and they have potential of giving bad complications, then I insist on these therapies also, because of the combination, we can actually reduce the time of the improvement, right? So when somebody will take around 4 to 6 months in getting better by medications alone, when we give these therapies, we can achieve the same results in 6 to 8 weeks of time. So that's the importance of these therapies, and especially when we talk about adult acne. Now, as I discussed earlier, adult acne, they require hormonal medications and certain medications to fix the metabolism. Now, hormonal medications cannot be given to all the females. Reason? Sometimes they are planning for a family, sometimes there are other issues, and because of that, we cannot give them these contraceptive pills and hormonal pills. So these patients are also candidate for these therapies, especially the carbon facial, which is done by laser, is a wonderful treatment for adult acne. So by one session, we can actually make the person better for 4 to 6 weeks of time without the help of any oral medication. Now coming to the complications of acne. Okay, so I'll tell you, I'm getting a lot of questions, and once I'll finish this topic in the next 10 minutes, I'll be answering all your queries. Okay, so you keep on posting your questions, and I'll be answering each and every question in detail. So coming to the complications of acne. Now, complications of acne, they depend on the type of acne, right? So when we talk about comedonal acne, the complication is open pores, right? So open pores are not pores. Pores are supposed to be open. We are mammals, and we are supposed to have these openings in our skin because of the hair follicle and the sebaceous gland. But few people, they develop small tiny pits in the cheeks. These pits are because of comedonal acne. Okay, so they are so tiny that we normally do not call them scars, but we call them open pores. So these open pores are type of scars which are like this, right? We also call them ice pick scars. So this is the complication of comedonal acne. Acne vulgaris, they lead to hyperpigmentation like dark spots and box scars, or you can say minor scars. Then nodular acne and the adult acne, they cause severe scarring, like very deep scars. The skin becomes undulated, right? So there are big holes in the skin and it's not smooth. So in general, if we talk about the complications of acne, there are two types of complications. One, the scarring, and second, the hyperpigmentation or the spots, dark spots in the skin. Now, the treatment of the complications. So complications, the first thing is to prevent the complications. So the first thing, which is very important, is the timely treatment of your acne. In fact, this is the reason why we treat acne, so that we can avoid the complications or we can prevent the complications. So timely treatment is important. Also, do not squeeze your skin, do not pop your pimples, so that we can minimize these complications. Now suppose you did everything but still you got certain pigmented spots. So for the hyperpigmentation, certain things can be done. One, avoid direct sunlight, right? As we know, ultraviolet rays, they are the strongest influencer of melanin production. So if ultraviolet rays will fall on these spots, the spots will get darker. So sunscreen application. Now a lot of people will say that, doctor, I'm staying indoors and locked down, why should I apply the sunscreen? My answer is, outdoor exposure of ultraviolet rays is there, everybody knows, but there is a significant amount of indoor exposure as well. So all these CFLs, right? If you suppose you're sitting next to a window, you're reading something or doing something, then also you are potentially exposed, right? So that's one thing. Second, there is a new type of light called as blue light. Blue light is emitted by the screens. Now in lockdown, everybody is watching something on their mobile phones or on their laptops or television. So this blue light is also very important for the hyperpigmentation. And to block the blue light also, you need a sunscreen. So make sunscreen application a routine of your skincare. It has to be used every day. And now, good habits. If you follow these good habits, they will become, they'll come in your routine. If you develop a habit of applying sunscreen, it will pay you in the long run, because lockdown is not going to stay forever. But if you develop this habit in this lockdown period, it's going to pay you later as well. So sunscreen application is one thing. Then you can apply vitamin C topically. So vitamin C is a very safe molecule, is a vitamin which has good skin lightening properties, and it is freely available in the market. So at least for the time being, you can use these two measures to take care of the dark spots because of acne. Now coming to the acne scars. Now what are scars? To understand the scarring, we need to understand the structure of the skin. So skin has got three layers. One is the epidermis, second the dermis, and then hypodermis or subcutaneous tissue, like tissue beneath the skin. Pigmentary changes are mostly seen because of the involvement of the top layer, epidermis. Scarring is because of defects in the deeper layer caused as dermis. So when these acne, especially the nodular acne, when they're there and we do not take proper treatment, we get severe scars. Why? Because of the damage in the collagen which is there in the deep layer of the skin. So cause of acne scarring, collagen damage. Why collagen got damaged? Because of your acne. Because of inflammation which was there in the acne. So earlier you treat acne, minimum will be the scarring. Now when we see a patient with acne scarring, we again do the grading. What type of acne scarring person has? Mild, moderate or very severe. And depending on the type of scars, we choose a treatment. In general, acne scars are treated by the therapies which are called as collagen stimulation therapies or collagen induction therapies. So what we do in these therapies, we trigger the collagen production. Why we trigger the collagen production? Because scarring is because of loss of collagen, damaged collagen, right? So we stimulate the production of collagen, and because of that, the scars, they keep on getting filled up. Right? So this is how we treat acne scars. Now, depending on the severity of acne scars, we pick different treatments. There are various treatments available for post-acne scars, microneedling. So there is a very basic microneedling, which is called as derma rollers. We normally do not use the derma rollers in our practice because of poor efficacy. We use Dermapen 4, which is one of the best and patented microneedling system in the world. So microneedling, then fractional CO2 lasers, then microneedling RF, then there are certain acne procedures, acne scar procedures like subcision, dermabrasion. So there are various fillers, fat grafting, PRP therapy. There are many treatments which can be done for acne scarring. The purpose is to stimulate the collagen. Now, when we treat acne scarring, we see at what level the scars are, what type of scarring is there. If there is a fibrous tissue beneath the scars, we cut that fibrous band by a needle that is called a subcision. So it's a combination of different therapies which we use to treat the acne scars. Acne scars that take time. In general, the treatment is given from 6 to 12 months. Unfortunately, medicines and creams are not effective for acne scars. Why? Because acne scar is not a disease. It is a sequelae. Acne scars occurred because of a disease, acne, right? So creams, oral medications, they are not effective in the treatment of acne scars. So acne scars are treated. The good thing is the results of the treatment of acne scars are permanent. So once you treat acne scars, the results, they stay throughout the life. So we have covered the type of acne, the causes of acne, different types of acne, how to treat acne, what precautions you should take when you are suffering from acne, do's and don'ts, and the complications of acne like post-acne pigmentation and post-acne scars. Now I'll be answering the questions of the audience. So we have any questions? How to reduce dark spots on the face? Mangla Priya Vishwanathan. So, Ms. Vishwanathan, dark spots, you haven't mentioned what type of dark spots you're having. They can be freckles, which are tiny brown spots. We also call them sunspots, which are seen on the cheeks, mostly in the fair skinned people. We also see sunspots in Europeans and a lot of people who live northern part of the country. So freckles can be there. Melasma, which is also, we call them jhaiya, right? Big brown patches on the cheeks and sometimes the nose as well. So collectively, there are different causes and different types of treatments for dark spots, but in general, you should take certain precautions. and that works on all type of brown spots. So one, use a good sunscreen every 2 or 3 hours, right? If you're going out, also take direct sun protection, because none of the sunscreen works if not taking direct sun protection. So good sunscreen application, direct sun protection, that's the first and most important thing you should do. Second, if you're suffering from dark spots, also get your blood test done. Anemia is one of the factor which sometimes precipitates and makes these dark spots worsen. So these are the things. And dark circles, Dr. Nikita Kashyap. Dark circles, they are not very easy to treat. I'll tell you, there are different types of dark circles. There are dark circles are seen in people who have a family history of dark circles, number one. Number two, there are dark circles which are seen in people who do not sleep properly, and the people who are stressed out, right? Since you're a doctor, most probably it's a sleep deprivation. And then there are dark circles which are because of the under eye hollowness. A lot of people, they have hollowness in this area, and because of the shadow, the area looks dark. Treatment is individualized. So there are certain creams which can be used to correct the dark circles. There are, at night you can use a retinol based cream, and in the morning you can use a cream which contains skin lightening products like kojic acid, vitamin C, arbutin. So a combination of these two things will make your dark circles better. There are few people who are allergic in nature. They sneeze a lot, they have excessive dryness, they have asthma, sometimes they have runny nose, like allergic rhinitis also. They are dark circles, they have a different pathology altogether. So they are dark circles, they respond better to hyaluronic acid based cream. So if you apply this hyaluronic acid based cream 2-3 times in a day, these dark circles will definitely respond. If your dark circles are because of under eye hollowness, so there's a very simple test. To just bend your neck and then look into the mirror. If you see that there is under eye hollowness, then your dark circles are not going to respond to any cream. Rather, you will require under eye filler. The moment we correct the volume loss in this area, the dark circles, they vanish. In fact, these type of dark circles are one of the best ones to treat because the results can be seen just in 30 minutes of time. Jyoti Arneja Sharma, you have oily hair and because of that I get acne. So this is a common misbelief that because of dandruff people get acne, or because of oily head, oily scalp they get acne. But still there is a connection. The connection is there is one common cause for these two problems. So when your glands, they secrete too much of oil, you get acne on the face and you get dandruff on the scalp. So this dandruff is not giving you acne, but the same reason of excessive oil production from your oil glands and scalp is giving you these two different issues. So for the oily scalp, improve your shampooing habits. Use shampoo, do shampooing. Being a female, you cannot do it every day. For men, I suggest you should do shampooing every day. For females, you can use shampoo alternate days so that you can remove the excessive oil which is there on the scalp. For the face, use salicylic acid or benzoyl peroxide based face wash so that we can declog the pores and we can reduce the oil secretion from your oil glands. Sometimes we require medicated shampoos like ketoconazole based shampoos to reduce the oil secretion from the scalp. So then that helps. Then Dr. Akmal, how to control acne, I've already discussed, I've already told in detail. Any remedy for open pores and dark spots? Dark spots I've covered. Open pores. See, as I discussed, open pores are mostly scars caused by the comedonal acne. So by using home remedies or by using any creams are not going to make them better. But there are a couple of things which work. You can use certain toners. So for the time being, you'll see that they have got a little smaller. You can use retinol based creams, and these creams also make open pores little better. But ideally, seek a dermatologist's opinion, and there are certain treatments which can actually make your open pores and these ice-pick scars better. Mr. Bipin Patel, many believe that eating oily food can make skin oily and aggravate acne. It is true or it is a myth? So it's not like if you're eating oily food that oil is coming out through your glands. So there is no connection, right? But you're partially correct. As I told you, our metabolism also influences our acne. So anything which has high glycemic index, like mangoes or sugary fruits, something which has got too much of sugar in it, fast food, sweets. So these kind of dietary items, they give you a spike in your blood sugar. And metabolic syndrome requires low glycemic food, right? So these kind of diets like carbohydrates, high calorie diet, they increase insulin resistance, right? In the same manner, if you take much of oil in your diet, that means you're taking extra calories. This will lead to insulin resistance and your acne will be aggravated. The same is correct with the dairy products as well. So in the diet, dairy products are associated with aggravation of acne, and the acne, pre-existing acne, may also become a little more severe, right? The reason, dairy products, they have lactose, and lactose leads to insulin resistance, right? So if you are having acne, you should avoid dairy food. You should avoid high any food which has got high glycemic index. So what you should eat? You should eat food which is low in calories. Increase your physical activity. Try to stay on a leaner side, right? Do regular exercising, and these things will make your acne better. Are acne scars in early age or permanent? Acne scars are always permanent. Once there is a scar, it's not going to improve on its own. So doesn't matter what age you have, but if there is acne scar, it's going to stay unless it is treated. So get your scars treated. Is it okay to apply aloe vera? Harshit Khanna. Yes, it is okay to apply aloe vera, provided you are applying aloe vera, because most of the creams on the market, they hardly have good amount of aloe vera. They have got 5 to 10% concentration of aloe vera. 80% is nothing but the gel base. So good quality of the aloe vera should be there. Then how many days a week fruit face packs can be applied? Kaja shake. I'll rather recommend eat these fruits because the application is not going to help you. Eating is important. Application doesn't do anything. It just gives you a false sense of uh, uh, well-being that you are doing something good for your skin. Right? It's not going to help. Fatima, can I use retinol 1% at age 34 for pigmentation and scars too and acne too? Of course, Fatima, you can use retinol 1%, provided you are not planning a family or you're not pregnant or lactating right now, because it should not be used in pregnant females. Nandini Sharma, can we use derma roller at home? Nandini, derma roller at home does not work. I'll tell you. So derma roller, when people use at their home, they stay very superficial. As I told you, there is epidermis, and if you're treating epidermis is treatment of the epidermis is not going to make your scars better, because the scars are there in the dermis, in the deeper layer. So the home derma rollers are ineffective. Should I go for facial twice in a month? Suparna Datta. Suparna, most of the facials done in salons and beauty parlors, they're not skin friendly. Most of these facials have certain components which most of these facials are actually based on bleaches, right? So you're getting a facial done, you don't know what is there in that facial, and the person who is doing it again, he doesn't know. what is there in that facial. So most of these facials, they are based out of bleaches and chemicals, and they give you instant glow because of the bleaching effect, but in the long run they damage your skin. Rather, you should go for medifacials. So medifacials are done under the supervision of dermatologists, and skin-friendly products are used like alpha hydroxy acids, beta hydroxy acids, and microdermabrasion. Couple of things are there. Hydrofacial is there. So these are the procedures which use natural ingredients like vitamins, antioxidants, and skin-friendly products, so that your skin glows and it also gets better over the period of time in the long run. Mujib Ansari, please share your views on glycolic acid combination and treating pigmented skin. Mujib, glycolic acid is an alpha hydroxy acid and is a very good exfoliating agent, right? So if you're using glycolic acid creams, these creams, they mostly have glycolic acid concentration ranging from 2% to 10%. Beyond 10%, I'll say take medical opinion. So if you're not having sensitive skin, if your skin is not having rosacea, you can use glycolic acid. It increases the cellular turnover and reduces the synthesis of melasma in the skin. So over the period of time, you'll see that your pigmentation is getting lighter. Shelly Thakral, can acne because of PCOD be controlled? Of course, they can be controlled, provided your doctor gives you right hormonal pills, certain medications to take care of your metabolism, and also therapies as per your severity of acne. So they can be controlled. Ruby Das, which sunscreen should be used for oily skin? For the oily skin, I always recommend you should use a sunscreen which is gel based. So these gel based sunscreens, they give you a matte finish and they do not make your skin greasy. Rather than using cream based sunscreens, you should use emulsions or lotions, right? So they're soft, non-sticky, non-greasy, and people, when they use them, they're comfortable. So a big no to cream based sunscreens. Fatima, I have alopecia areata and patterned hair loss. So it's a different topic altogether. Alopecia and patterned hair loss should see a dermatologist. There are treatments available. Does eating dry fruit be a reason for acne? No, dry fruits do not give you acne. I eat dry fruits every day. I do not have even a single acne. So this is a myth. When acne are there, you will always try to correlate your acne with something. That's not true. Get a proper treatment. Otherwise, you'll keep on correlating your acne to one thing or other thing, and you'll lose precious time where you could have taken a treatment. Amanarya, dairy products. Of course, dairy products, like I discussed, dairy products, they cause acne, and sometimes they exacerbate acne because of insulin resistance. So dairy products should not be taken if you're having active acne. Which shampoo should be used to prevent hair loss? Samantha, shampoos do not prevent hair loss. This is a myth, right? This FMCG industry has created this illusion that using a shampoo, by using a shampoo, you're getting beautiful, long, and healthy hair. This is not correct. Hair loss is because of various reasons. If there is hair fall, it's mostly because of nutrition deficiencies. If there is hair thinning, like patterned hair thinning, especially from this area or from the sides, it is mostly because of hormones. They require specific treatments, improve your diet. Shampoos are made to cleanse your scalp, right? So as per the type of your scalp and hair, you can go for different shampoos, right? But shampoos are not going to reduce the hair fall. They're not going to make your hair better and thicker. This is a misbelief. Mr. Chauhan, can we use glutathione for the long run? It's a controversial topic. Glutathione is a supplement, but there's a lot of hype has been created about this molecule that by taking glutathione you'll become fair like Snow White. It's not correct. Okay, glutathione is a very good supplement. It's a very good antioxidant. You can take it every day. It will make your skin quality better, It might make your skin a little lighter in shade. It may make your pigmentation a little better, but if you're expecting that after taking retinol you'll become 3-4 shades lighter, you'll become like a Snow White or you'll look like a alien, not true, right? It's a misconception. So hope I have answered all the queries which you have, and I hope that you enjoyed this session. I'll request all of you to stay indoors and follow this social distancing and follow the lockdown. Hopefully this COVID-19 will get over soon, and hope to see you again.
Yeah.